Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel helping you to live your best life. Today I wanted to visit about osteoporosis. This is a topic that many people will already know about. Osteoporosis is a huge problem, affects tons of people, and significantly decreases quality of life, especially in older people. In medical school, I was taught about osteoporosis. I didn't really think that it was an inflammatory condition at the time, but my study seems to suggest that this is a big component of osteoporosis for many patients. I'm going to read from a list of what are called common causes of osteoporosis. These include being postmenopausal, chronic steroid use, if you have decreased intake of calcium and vitamin D, lack of menstrual periods, eating disorders, decreased absorption of minerals from gastrointestinal surgery, cigarette smoking, alcohol use, decreased activity, decreased testosterone level, and then medications such as hormone treatments for prostate or breast cancer and anti-epileptic medications. The last thing would be increased inflammation, and this is what I didn't really focus on, at least when I was in medical school. The suggested treatments for osteoporosis are weight-bearing exercise, calcium and vitamin D supplementation, avoiding alcohol, and avoiding smoking. There are many treatment classes of medications that are out there that can be used for osteoporosis. We have estrogen. Estrogen stimulates osteoblasts, which help to produce new bone. We have estrogen mimics that help to bind to the estrogen receptors and prevent bone turnover or bone resorption. We also have a class of medicines called bisphosphonates. These medications seem to inhibit osteoclasts, which are those cells that eat up or chew up new bone. We have monoclonal antibodies that have come on the scene. These also help to prevent osteoclast overactivity. The newest medications are bone-building drugs that are used for people that have severe osteoporosis or steroid-induced osteoporosis. The inflammatory aspect of osteoporosis was what I was not exactly aware of or did not focus on in medical school. The balance between bone building and take-up of bone is significantly impacted by increased inflammation in your body. One part of your immune system that has been identified to act on bone is mast cells. Mast cells are histamine releasing type cells that are present in your body. If these cells are overactive, it is felt that they can contribute to significant bone resorption or decreased bone mineral density, and then resultant osteoporosis. Mast cells tend to be stimulated when your immune system is revved up. In other videos, I've talked about calming your immune system. The balance between the autonomic aspects of your nervous system, such as parasympathetic and sympathetic, can make a big difference in regulating how brisk your response is, how much inflammation you have in your body. For example, when people have increased stress, they have increased release of hormones that trigger your pituitary gland to release other hormones that stimulate mast cell activation. So obviously, any techniques that you can use to reduce stress may be beneficial and prevent progression of osteoporosis. Mast cells release histamine, and there's been thoughts that using antihistamines may improve mast cell function and decrease risk of osteoporosis. In fact, this has been studied in a head-to-head trial, and it was shown that indeed patients that were treated with standard treatment, but then also standard treatment plus a histamine receptor blocker, had improved bone mineral density and less evidence of osteoporosis. There are antihistamine diets that you can download or review online that talk about many foods that tend to trigger histamine release, and these may impact the function of your mast cells. Any general efforts at calming your autonomic nervous system, such as been what is discussed in other videos, can be helpful as well. Other medications can be very important in osteoporosis in some cases too. I see many patients that take proton pump inhibitors, medications for acid reflux. These medications can interfere with calcium and vitamin D absorption, unfortunately. If you don't absorb these vitamins and minerals, of course, you're more likely to develop osteoporosis. Proton pump inhibitors are really intended to be for short-term use for most people, but it is common to see people that take these for many years. The suppression of stomach acid also affects your small intestinal bacterial flora and has been shown to have some interaction with inflammation in your immune system overall as well. If you do take a proton pump inhibitor and you are able to get off of that, that may decrease your risk for osteoporosis. Testosterone and estrogen are big ones. As physicians, we have been afraid to prescribe these medications for fear of causing cancer or other complications. Some of the studies that indicated possible risk back in the day were not well done and have been pretty much debunked if you truly look at these studies with great detail. That does not mean that there is not a risk of cancer with hormone replacement therapy, but it just means that we can't prove that very well. We don't have a good study to prove it. Treating with estrogen and testosterone may be very beneficial for prevention of osteoporosis. To summarize, osteoporosis is a debilitating condition. It affects many people, especially as they get older. Women are affected more than men, unfortunately. This condition probably has a lot of basis in inflammation. This is probably not addressed well in many people. There are certain medications that put you at greater risk for osteoporosis, and if you can avoid those, that would be great. Improving autonomic balance, using antihistamines, and then even addressing things such as small intestinal gut health might be beneficial for reducing inflammation and decreasing your risk for osteoporosis. If you are my patient, I hope you find this information interesting and helpful. If you are not my patient, please see your own doctor for diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Thank you. Signing off.